So, welcome back to section 2 of this 3-part rolling group workshop online on anxiety and panic. So, we've reached our first activity for today. For this activity, I'd like you to just spend a few moments imagining the following scenarios and thinking about how you might feel if they happened to you. So, for the first scenario, just imagining that you are walking home late at night and notice that you're being followed. The second scenario is that you arrive at the airport and notice you can't find your passport. And the third scenario is that you are in the park and realise that you can't see your child. So just spend a few moments just thinking about how these situations or scenarios might make you feel. Perhaps using your pen and paper to make any notes. So let's take a minute to think about what you might have experienced during these scenarios. Thinking back to the CBT model, what thoughts might have gone through your mind in these situations? You might have had a lot of upsetting thoughts or worries, a lot of predicting the future and worst case scenarios and catastrophizing. And what feelings do you think you'd experience? You might have felt scared, fearful. And what physical changes do you think you'd notice in your body? For example, you might have noticed your heart rate increase or your palms going sweaty, or even feel lightheaded and dizzy. And finally, what behaviours do you think you would have engaged in? Or in other words, what did you do? Would you run away or try to avoid being in that situation altogether? And were there any other symptoms that you noticed during these situations? These responses are very common and characteristic of anxiety. The response can happen very quickly, leading to a sudden and intense increase in anxiety levels. Ultimately, you're most likely going to panic. So what is panic? Panic attacks feel like a sudden rush of intense fear or intense discomfort that can reach a peak within minutes. People often feel they are losing control or are going to have health complications such as a heart attack or a stroke. So if you think back to the physical symptoms we discussed on the previous slides, you might experience your heart rate increasing, and you might misinterpret this as a heart attack. Panic disorder is a mental health condition characterized by reoccurring unexpected panic attacks. So panic disorder is also characterized by the preoccupation of having panic attacks, which then leads to more panic attacks. But for the nature of the presentation today, we are just going to focus mainly on panic attacks and not panic disorder. So here are some common symptoms of panic. You might notice heart palpitations, sweating, trembling or shaking, shortness of breath, choking, dry throats, chest pain or discomfort, nausea or abdominal distress. You might feel dizzy, lightheaded or faint, chills or heat sensations, numbness or tingling sensations, feeling detached from self and reality, fear of losing control or going crazy, and fear of dying. So how do these symptoms relate to the fight or flight response? As I mentioned earlier on in the workshop, the fight or flight response, as terrifying and scary as it may feel or seem, is actually designed to keep us alive. But the question is how? So there's a reason why the body undergoes a range of physiological changes when faced with dangerous or threatening situations, and it's ultimately to prepare the body to run away or fight the situation it perceives as threatening. For example, if you notice your heart beating faster or experience a tight chest, it's because the body is trying to pump more blood and therefore oxygen around the body to the muscles so that they can be used to fight or run away from this danger. Similarly, you might feel short of breath or the breath becoming quicker, and this is also a way for the body to take in more oxygen to power the muscles or limbs. Now, let me introduce you to Caveman Ian. As you can see, he's experiencing a range of different physical symptoms, as well as the ones we've just discussed. For example, he experiences a dry mouth and has difficulty swallowing, as this allows the digestive system to slow down or stop, because it's not needed and therefore allows to preserve energy to attack or run away. Ian is also experiencing frequent urination or diarrhea, and this is to get rid of any waste in the body so that it's lighter to attack or run away. Another common symptom is excessive sweating. This allows the body to cool itself down, Ian also is feeling very lightheaded and dizzy and is experiencing a headache. This is the brain sending biochemical messages to release adrenaline, again, so more oxygen is pumped around the body to power the muscles and the limbs. Ian is also experiencing excessive worrying and a lack of concentration. This is because quicker thinking enables evaluation of danger and rapid decision making. And finally, his vision has gone slightly blurry, and this is because the pupils are dilating to sharpen his vision. So as you can see, this intense experience of fear is designed to protect you from danger and not to actually cause you harm. And this might help reassure you when you're experiencing symptoms of a panic attack. So what are the causes of panic attacks? There's a range of reasons why you might be experiencing panic attacks. It could be that you're worrying about your health, possibly because someone close to you has passed away or has had a serious illness or has a serious illness. Or you might be worrying that doctors have missed symptoms during a routine checkup or test. Or you might be worrying about physical symptoms or marks on the body. For example, the heart beating faster as a symptom of anxiety or panic attack is often misinterpreted as a heart attack. Another cause of panic attacks could be related to severe stress. For example, the death of a loved one, going through divorce or separation, losing your job, moving house, difficulties at work, or even having a baby. And finally, other triggers might include being in confined spaces, public speaking, being on public transport, anticipating a difficult conversation, emotions, so when we have something upsetting or unpleasant emotions that we have been avoiding. And finally, they can sometimes occur out of the blue. In other words, sometimes there may be no obvious trigger.